Hello, I'm Dr. Joshua van der Aert. I'm the aesthetic injectable specialist for Praktijk Gabriels, working in Barendrecht and Amsterdam. I specialize in all the non-surgical aesthetic treatments. So that means fillers, liquid facelifts, laser treatment, everything. We started out doing mainly lips, the lip fillers. We use the cannula technique for the most natural results. Seeing more and more patients, treating more and more patients, we moved into different areas as well. Currently we have non-surgical treatments for pretty much every part of the body, starting with the liquid facelifts, the mid facelifts, cheekbone augmentations, chin and jawline augmentations. We use a variety of techniques, a variety of different products for whether if you want to create some volume or some fine sculpting in the chin or in the jawline. What we also do is the liquid rhinoplasty, where we use fillers to adjust the nose. A lot of people have a dorsal hump, making the nose look really unappealing, and it's really this huge weight on their psyche. And often patients are afraid of surgery. Surgery has a lot of downtime, a lot of risk, it leaves scars, it's not always satisfactory. So that's really what keeps people from committing to surgery, and what brings people to us. We don't have a lot of downtime. You can just come in and out. So if you want to have a liquid rhinoplasty or a liquid facelift, it's only going to take you about 10 to 30 minutes, and you can walk right out the door and go about your day. And I think that's really made this side of the aesthetics really approachable to people. The cost is also a lot lower than surgery. The risk is a lot lower. You don't have any downtime. So as far as products go, for the lips, I really like to use the Belotero Intense by Merz. It's a really tough product. It gives a good volume while maintaining the normal elasticity that you would need in the lip tissue, so you don't feel it tugging. It's very natural if you place it and massage it in right. It lasts about 6 to 9 months, depending on the patient, sometimes more, rarely less, unless you have a very high metabolism or you're smoking. So that's really my go-to product for the lips. For the smokers' lines and small creases, you have the Belotero Soft. It's a lot more fluid. It's placed very superficially into the skin, just for really bumping up those fine lines in the glabellar area, the smokers' lines. These creases around the mouth that the women always complain their makeup gets stuck in if they don't have really a volume deficit yet. That's to be filled with a lot sturdier products. You can just fill the superficial creases with something very fluid. Lasts about 6 months. You have the Belotero Balance, also a really nice product. It's excellent for tear trough work, the hollows underneath the eyes. You can do nasolabials with it. Everything that's fairly superficial but not really in the skin is perfect. It's really sturdy and still very malleable, so you can really place it and then mold it into the shape and area you want it molded into. Very, very versatile, useful filler. Could be used pretty much anywhere in the face as well. Lasts about 1 year to 1.5 years, depending on the position in the face it is placed in. Then you have also the Radius, which is pretty much a breakthrough in filler technology. It's not hyaluronic acid, it's calcium hydroxyapatite, and it not only does it create a lot of volume, it really stimulates the neocollagenesis, which is formation of new collagen. It's for the elasticity and the suppleness and the youthfulness of the skin. So if we do the liquid facelifts with the Radius, you will notice that the volume deficits created by aging the volume deficits will be lifted, and the skin will also be freshened up. It will give a more glowing, healthy, youthful shine, and it gives the collagenesis gives lifting ability as well. So this is really what we like to use for the liquid facelifts. It's also an excellent product for chin and jawline augmentation, and it lasts about 1.5 to 2 years, sometimes 2.5 to 3, depending on what you use it in. Radiesse can also be used in a diluted fashion for rejuvenation of the cleavage. It's a zone that gets a lot of wrinkles with aging because it catches a lot of sun perpendicular to the skin, so it's really high concentrated sunbeams. Catches a lot of radiation and makes you look very old, so we can really youthen that up, freshen that whole area up. It can be used in the hands, in the neck region, in this hyperdiluted fashion. Just if you don't want the volume, but strictly the neocollagenesis for freshening of the skin. It's a really versatile product. I really love it. You can do pretty much anything with it. Then we've recently branched out into Etermis, also a filler from Merz. It's a different type of filler. It's also hyaluronic acid. It's a bit firmer than the rest, and I really like to use it for my mid facelifts, depositing it in the deep medial cheek fat compartment, where we also lose a lot of volume with aging, stress, weight loss, sleep deprivation, and it can really lift that whole area right up, and you can pull that through into the cheekbones to really give that facial rejuvenation while just maintaining your natural anatomic, your natural anatomy. So your face doesn't look treated. It's the same face you had 10 years ago, so you just look younger because we fill all the relevant areas, the places where you lost bone, the places where you lost fat, so we're not going to create volume where there wasn't any before. It's just to restore your natural youthful look. It's also a very nice product to use for liquid rhinoplasties. It's firm, so that means that it stays in place for quite a long time, and at the meantime it's very malleable, because over the nose we have very thin skin. So everything you put there is going to be very visible. So you really need to be able to knead it into the position that you want it put in, and then you want it to stay there for as long as possible. And that's really, I found that Etermis is really pretty much my go-to product for the noses because of that reason. Alright, that's a bit of a short intro into what we do, the products we use for what we do and why we use them, and why we recommend certain treatments. If you have any more info, you can always call us to set up your free introductory consultation. Treatments are always immediately possible.